Takulandirani ku AMTV Malawi kuchimake kwa nkhani zenizeni. Ngati nkhani imeneyo kuno kulibe, dziwani kuti nkhani imeneyo ndi yabodza.
Thank you. It's a big hand for the national anthem. Thank you so much. Thank you.
Honorable Kundise Kandomichikoda, MD, Minister of Health of the Republic of Malawi. This is the Nairobi, representative of the chairperson of the East Central and Central Africa Health Ministers Conference and Deputy Permanent Secretary of the Health of the Kingdom of Lesotho. All cabinet ministers, deputy ministers, and heads of delegations here present. Mr. Sibusiso Sibanze, Acting Director General of East Central and Southern Africa Health Community. Mr. Samson Ndolo, Committee and Secretary of Health, Dr. Lakis Kwese, Secretary to the Vice President and all the government officials here present, Your Excellency, Heads of Diplomatic Corps here present, WHO Rep. Dr. Kimambo, UNFPA Representative Madam Rodriguez, Honorable Alfred Gia, Member of Parliament, Honorable Mr. Senator Swese, all government partners here present, Dr. Matthias Joshua, the officiating clergy, distinguished by the guests, ladies and gentlemen, and I shouldn't forget members of the media. Honorable Ministers of Health, distinguished delegates, and esteemed guests, I am privileged to address you today at this critical conference. On behalf of our President, His Excellency Dr. Lazarus Chakwera, and the people of Malawi, I extend warm greetings and appreciation for your presence. Please feel free, feel at home. We are in the warm heart of Africa. And I'm certain that you have already felt the warmth of our people through their smiles and kindness. I further invite you to make a moment to experience the exceptional strength of Malawi and the stunning natural beauty of Lilongwe, our capital city. Honorable ministers, delegates, ladies and gentlemen, I would like to begin by acknowledging the tireless efforts of our ministers of health, who work diligently to improve the well-being of our citizens. Your dedication to addressing the complex health challenges facing our continent is truly commendable. It is therefore a great honor for me to stand before you today at the 74th East Central and Southern Africa EXA Health Ministers Conference, as we come together to reflect on our shared journey and plan our future following the EXA Health Community Golden Jubilee in June 2024. I would like to congratulate all EXA member states for their unwavering support and commitment to this health community. Addressing our country's significant health challenges require collective action, as diseases know no boundaries. The theme for this conference, looking ahead after the Golden Jubilee, encourages us to celebrate our past achievements and lessons learned while also embracing a future that is uncertain yet full of promise. Honorable Minister for Malawi and also delegates here, let me say I'm particularly delighted that the theme for this conference is looking ahead after the Golden Jubilee. This means looking ahead, capturing what we have achieved in the past, and then getting informed. This is where knowledge management is very, very critical. Because for us to move ahead, we need to understand what has worked and what has not worked. And as people that interact with people in the health sector, it is very, very critical that even the similar and related immunological instructions that come from people should be captured, because they do inform the way forward. So I'm particularly very happy with the theme because it resonates with the development in this sector. This conference unites all EXA member states. We have Eswatini, Kenya, Lesotho, Malawi, Mauritius, Tanzania, Uganda, Zambia, and Zimbabwe. Each of the member states bring invaluable insights and diverse experiences to collaboratively chart a path towards achieving a healthier population across the region. As we look to the future, we must acknowledge the significant progress we have made in healthcare, as well as the work that still lies ahead to achieve our vision. I'm pleased to hear that the EXA Secretariat will be launching a strategic plan for 2024 to 2034 during the meeting. This strategy is a significant step towards uniting our efforts and providing a roadmap for the next 10 days. I look forward to a policy that will help us address our pressing needs. I pray and hope, again, Madam Minister, that the strategy will ensure that knowledge management system is funded. Because many times we look at other areas and we forget or overlook the critical value of knowledge management in this health sector. Honorable Ministers, delegates, ladies and gentlemen, I wish to mention the following regarding the conference subfields. Number one, first, we must enhance our capacity to manage health emergencies and build resilience. The COVID-19 pandemic has emphasized the critical need for coordinated and proactive responses to health crises. By leveraging local knowledge, fostering partnerships, and investing in infrastructure, we create a robust and adaptive health system that addresses not only pandemics, but also other public health emergencies. Number two, equally important is the health of our women, children, and adolescents. Mortality rates remain high in this region. We must do more to ensure that every woman has access to quality reproductive health services and that our youth receive comprehensive education on health and wellness. Number three, our region faces a significant challenge due to the coexistence of communicable and non-communicable diseases. Communicable diseases like HIV/AIDS, tuberculosis, and malaria, which remain leading causes of illness and death. At the same time, non-communicable diseases, including cardiovascular illnesses, diabetes, cancer, mental health disorders, and chronic respiratory diseases are on the rise. This dual burden places enormous pressure on our health systems, highlighting the need for a comprehensive approach that prioritizes prevention, early detection, treatment, and the establishment of a robust health infrastructure. Number four, which is finally, among the numerous other issues, we must prioritize health data integration and financing. Robust data is vital for informed decision-making and resource allocation. Countries across the region must invest in the health information systems that facilitate data sharing and analysis. Innovative financing strategies, including public-private partnerships, will be key to sustaining improvements in the health systems. Honorable Ministers, delegates, ladies and gentlemen, as we look to the future, let us embrace collaboration and a shared sense of purpose. The deadlines for the Sustainable Development Goals and other regional and international commitments are approaching quickly, and some of our countries are still lagging. The success of our nations depends on our ability to work together, innovate, and effectively address the health needs of our people. In conclusion, I would like to congratulate the organizing committee from the Ministry of Health Malawi, the Extra Secretariat, and all partners whose efforts have made this conference possible. I now declare the 74th Health Ministers Conference officially open. Thank you for listening.
Usaiwala kupanga subscribe ku channel ya AMTV Malawi.